Good evening and welcome everyone to this debate, which is the 10th and the 9th in the succession of debates which we've organised as a Royal Society of Edinburgh. First of all, can I introduce myself? I'm President of the Royal Society of Edinburgh. I'm John Arbuthnot. I was also previously the Principal of the University of Strathclyde, who own this magnificent hall. And I won't tell you the whole history of this hall, but my predecessor, Sir Graham Hills, bought this. It was in a state of dilapidation and was actually going to be demolished and made into a car park. And he managed to obtain the hall for the sum of £100. And during my whole 10 years at Strathclyde, it cost me many millions of pounds to actually do what we've done to it now, but we're very proud of it. So welcome. I reckon, counting back, that probably in presenting degree certificates here, I presented probably to just under 30,000 students over the time I was here. So tonight I create you all diplomats or diplomates of the Enlightenment, shall we say. So we've all got something out of this evening. The particular topic that we're going to be discussing this evening is the welfare system, and we have an excellent panel here to do that. And it's part, as I said, of a series of debates which we have designed along the lines of enlightening the constitutional debate that should go along with this period in the run-up to September 2014, when people of Scotland will decide whether or not they would like Scotland to be an independent country. You might say, well, why is the Royal Society of Edinburgh doing that? What business is it of us to do that? The point is that the Royal Society of Edinburgh was founded in 1783 by King George III with a very, very broad remit, which is for the advancement of learning and useful knowledge. And since that time, the Royal Society of Edinburgh has ensured that we cover all disciplines of learning, not just science or medicine, but science, medicine, law, business, public affairs, social affairs, a whole gamut of subjects. And our 1,600 fellows come from all of these disciplines. So we are actually ideally placed with that kind of expertise to organise this programme of events. And what we do is we record and we actually film the event, and that will then appear on the website of the Royal Society of Edinburgh very quickly, and a publication will appear very quickly within a couple of weeks. There are all the previous sessions have been published, and they are available in the room where you had coffee before coming into the hall. And when we have our last debate, which will take place in January, and which will be about currency and taxation, we will publish the whole series, which will appear as a book. And we hope that that book will appear in the first week of April, and will then serve as a compendium and a record of the issues that have been raised over this whole period in the run-up to the referendum. And as President, I was very keen to do that because it provides us with an archive of a very, very important part of Scottish history. If we had not done this, you will note that the coverage in the press is getting a bit better, a bit deeper, a bit more reflective, but until now has been very, very transient. The coverage in the media is very transient because that's the very nature of modern media. So to have an archive that covers this very serious run-up to the referendum by an independent organisation, we don't take any sides, we actually analyse the proposals as they come or as we know them at the time, and that's what we do. So that's the background to what we're doing. Very pleased that tonight's discussion is about welfare, because that is an extremely important element in terms of the national spend across the UK and in Scotland for the well-being and the protection of the most of our citizens who are the most likely to have difficulties. And of course, there's lots of political discussion about what benefits should be provided and what proportion of the national wealth should go into that. And these benefits, which you'll hear about this evening, are quite complex and I hope not too complicated. And we also have to remember that quite a bit of that has now been devolved to the Scottish Parliament. For instance, the Scottish Parliament is responsible for its own education budget. It's responsible for its health budget. And I played a role in the very formation of that Parliament and the creation of the health budget on how it might be fairly spread across Scotland. So these are elements where benefits, welfare, health, education are interlinked. And we can't avoid that. In fact, we shouldn't try to avoid it. But we have to be clear about it, and I'm sure our speakers will be. Just to remind you what we have covered so far. Scotland and the European Union was the first debate, with the discussion, obviously, of the proposal that Scotland might join the euro. Tax and spending, because we do some of these debates with the British Academy, who is a sister academy of the Royal Society of Edinburgh, was done in London. And the way in which the British Academy does its meetings is different from us. They do them in small groups where Chatham House rules are observed. And so we have a record of what is discussed and what is said, but not apportioned to any individual. And you can't get away with that in Scotland, folks, because we actually say and report what people said. But they did an initial assessment of that. There was then a major debate on defence and international relations and what an independent Scotland would have to take account of in relation to its defence. The real economy was another issue, which was a separate item. Currency and banking were dealt with also at the British Academy, and that proved to be such an important debate that we are actually going to have an extra debate in Scotland in January on currency and banking and financial services. Because what happens if Scotland were to become independent or to remain not independent country to the nation's finances are absolutely vital. We've done borders, immigration and citizenship. And in Aberdeen just recently, we had a major debate on science and higher education, and that is a debate which is now very alive, particularly among the research community and the universities of Scotland, because what happens to the budget for that, which is currently integrated through the Research Council system in the UK, is absolutely vital. So that is the background to what's happening generally and the background to what's being done this evening. And therefore, I'm now going to pass over to the chairman, and I'm going to thank Bob Black for acting as chair, putting together this excellent team, and having identified a whole series of very thoughtful aspects on welfare, which we're going to hear about. So, Bob, over to you.
Thank you very much, Sir John. My name is Shireen Nanjani. I'm going to be chairing tonight's debate, and may I say I'm delighted that this building wasn't turned into a car park, because it really is a magnificent building to hold this debate. As Sir John said, we're going to be looking at welfare and public services tonight, a big subject, and the debate about how we should deliver and how we can pay for all these things has definitely moved to centre stage recently in the context of the constitutional debate. We've got 5 speakers tonight with different areas of expertise who will lay out the issues as they see them and offer us, I think, some interesting comparisons that we can debate later on. I'm going to ask each of them to speak for 10 minutes, and then we'll open it up to the floor for questions and debate. So let me introduce our first speaker. And he's head of the poverty team at the Joseph Rowntree Foundation. He leads the Anti-Poverty Strategy Research Programme and joined JRF in 2003. He previously managed and conducted social research on drugs and crime at the Home Office and helped develop the Alcohol Harm Reduction Strategy at the Prime Minister's Strategy Unit in the Cabinet Office. He's been a member of the UK Commission for Employment and Skills Policy Expert Group and of the Social Research Association Board, and he joined the Social Security Advisory Committee in January of this year. Ladies and gentlemen, please welcome Chris Goulden.
Thanks very much. I'm afraid I'm going to veer off message almost instantly, and I'm not going to be talking about welfare. I'm going to be talking about something much more important, which is poverty. And I think we'd all agree that welfare is not the answer to poverty. Maybe we can discuss that later. So I want to talk about poverty in the UK, across the UK, and how it can be prevented and reduced in practice through an effective strategy. And all parts of the UK do have anti-poverty strategies at the moment. In Scotland, there's a prominent child poverty strategy, for instance. But I will explain why I think previous and current strategies that try to tackle poverty always seem to fail, and why this applies locally as well as nationally. And then I'll briefly set out our plan at Joseph Rowntree Foundation for trying to remedy some of these failures. You often hear people say that poverty will always be with us. I disagree. I've noticed that if you work in the poverty field, one thing you have to be is an optimist. It's true that in the UK we've had high levels of relative income poverty for many decades compared with other nations of Europe. And when you look in particular at the percentage of all people in the UK living below that poverty line after they've paid their housing costs, it's been no lower than 20% since the late 1980s. It's not risen to more than 25%, the optimist in me points out. But that flattish line does hide a huge amount of movement. Pensioners in particular have seen big improvements in their disposable incomes over the last few decades. And it's pretty clear that pension credit and a cohort of older people with better pensions have helped. Single pensioners have been the main beneficiaries in recent years. These are mostly women. Another group who have seen their prospects improve in the last decade is lone parents, also mostly women. The historic gender inequality underlying poverty has been rebalanced somewhat, partly through policy and partly through society's progress. But there are many faces of poverty. It's not a single issue problem, and no one policy will be enough to address it. A lack of breadth and ambition is one of the flaws of our current approach in all parts of the UK. I'm afraid that's not the only problem. There's also no compelling vision of what a poverty-free Scotland or a poverty-free UK would look like, although the prospect of independence is making that a more significant debate in Scotland than anywhere else in the UK at present. Having a clear destination is essential for any strategy. At the moment, in the UK Child Poverty Act, we just have a set of pretty abstract quantitative targets. These don't help to explain to citizens why we want to end poverty. And they don't tell us what kind of society and economy we'd be living in when 10% of children are in relative income poverty equivalised for household size, or 5% are in absolute poverty. In this case, absolute is a total misnomer in this definition. The third flaw is that there is no long-term cross-party support for anti-poverty policies. Since 2010, we've seen a rapid shift in approach from Westminster on poverty. So often, a new government will try to reinvent the wheel and refuse to take forward the good from the previous administration. This is on ideological rather than evidential grounds. Sometimes it doesn't even seem to be ideological, just petty politicking. This applies to all sides. The fourth point is that there are rarely links between the actions set out in a strategy and the outcomes that we seek. We have no idea how many children are going to be prevented from eventually entering poverty from the pupil premium in England, or how many adults are taken out of poverty long-term by welfare to work programmes. I appreciate why this doesn't happen. It's basically really hard to estimate the impacts because of the complexity of the problems. But that doesn't mean governments shouldn't try to do the best they can to show that what they are planning is likely to be sufficient or not. However, it's even more complicated than that. Not only are the effects on poverty important, the interactions between policies really matter, and this is often unaddressed. This is the fifth flaw. You can see this in the mixed messages coming from the coalition government in the UK on universal credit, national minimum wage, the living wage, and income tax thresholds, all policies that affect Scotland. And they're all relevant for poverty. They need to be coordinated to optimise their overall impact. But because they're led by different departments, DWP, BIS, Treasury, Cabinet Office, none of them are as effective as they could be. At worst, they even undermine each other, and they dilute the positive impact that they could have on people's lives. Poverty is experienced by individuals as their prospects and circumstances change over their life course. Other than some obscure targets about avoiding persistent poverty that haven't really been measured yet, a dynamic life course approach doesn't feature at the heart of our anti-poverty strategies. That's problem number 6. Usually children, young people, parents, older adults, pensioners are treated as if they have no connection, rather than being the same people at different stages of their lives. Overall, across the population, there are millions of people who are and have experienced poverty in the UK, but it's rare to see any involvement in the development and publication of anti-poverty initiatives. Some places are better than others, and JRF has definitely got a lot to learn here too. And in Scotland, I think it's fair to say that participation is more advanced than in any other part of the UK. The Poverty Alliance and the Poverty Truth Commission, in particular, are doing great work. But at the UK level, it will be hard to think of strategies for other issues, lone parents, ethnic minorities, carers, disabled people, where the people most affected have such little input. This lack of participation is a big issue. So these are the 7 fundamental problems as we see it. A lack of depth in policy, no vision for a poverty-free country, no long-term political consensus, shaky links between actions and outcomes, lack of consideration of interactions, a partial rather than a dynamic life course approach, and little to no participation. Our existing anti-poverty strategies can hardly be called strategies at all. At JRF, we want to show that these problems can be tackled. We are at the early stages of a large programme of research and policy development to create our own strategies for Scotland, Wales, Northern Ireland and the UK as a whole. At the moment, and who knows where we will be by then, we plan to publish the strategy for Scotland in 2016. These plans will be based on the best evidence about what works that we can find from around the world in over 30 areas of policy. We will also need big new ideas to revolutionise our failed approach on poverty, and I think we'll be hearing a bit more about some of those from other speakers. This week, we've published 20 visions of what a poverty-free UK might mean from leading thinkers across the political spectrum and from other viewpoints. These will help us to test out and build points of consensus about the goals of policy. Next year, we want to build a new model that takes account of life course changes and the dynamics of poverty to help us test out ideas and understand how they interact. And we have our own partnership underway with the Poverty Alliance in Scotland, who've brought together a panel of people experiencing poverty as another stiff test of our emerging thinking. We'll be supporting the Poverty Assembly in Scotland at the end of April next year as the culmination of some of this work. We don't know yet what our plan to produce a strategy will look like, but we think it's really important to try, and in doing so, change the nature of debate and some of the fatalism about poverty in the UK, and look towards a longer-term future where poverty is reduced to as low level as possible. I'm still optimistic. Thank you.
Thank you, Chris. Our next speaker is the Professor of Economics at Stirling University, and the referendum debate is keeping him pretty busy at the moment as he's called upon to test the claims of both sides of the debate with hard figures. His specialisms are labour economics, health economics and fiscal federalism, easy for me to say. He's advised various governmental and international bodies and was until recently the budget advisor to the Finance Committee at the Scottish Parliament, and he's currently researching the economics of constitutional change here in Scotland. Please welcome Professor David Berry.
Thank you. Thank you. I should say that I'm grateful to the ESRC who are helping fund the studies that I'm doing at the moment that relate to constitutional change in Scotland. I should also say that, unlike Chris, I'm actually going to focus mainly on welfare in my remarks. So I'm going to address the question of the size and the distribution of welfare spending in Scotland in the short to medium term, whether or not constitutional change occurs. In the long run, and I think some of the other speakers may address this, radical change may be possible, but in the short to medium term, we are where we are, and that's where we've got to start from. So, some figures to start off with. In 2012, total Scottish gross value added was around £112 billion. That's effectively the value of the goods and services produced in Scotland. That excludes the contribution from North Sea oil. Spending on social protection in Scotland was £21.3 billion, so about a sixth of the total value of production was allocated towards social protection. Most of that, £15.9 billion, was paid for by the Department of Work and Pensions, DWP, and that is focused on benefits and on the state pension. So the welfare budget goes to children, to those of working age, and to older people. The rest of social protection is paid for by a large chunk of it by local government, and it's allocated to things like childcare, housing, and social care for older people. So, 21.3 billion is the social protection budget. Income tax receipts in Scotland in 2012 were £10.7 billion. Petroleum revenue tax and corporation tax levied on North Sea oil and gas fields amounted to £9.3 billion. So together, income tax and North Sea taxes still do not cover the total costs of social protection in Scotland. Total receipts from all forms of revenue, including the North Sea, amounted to £42.4 billion. So there's around £21 billion to spend on everything else if you're going to balance your budget. Now, here's a controversial paragraph, and it picks up what Sir John was talking about, because it links to the discussion of the macroeconomic issues. It's difficult to envisage a prospect of significant expansion in the welfare budget over the short to medium term, either with or without independence. Why? Because of the constraints imposed by the accumulation of debt since the beginning of the recession. Had Scotland gone for independence in 2004, it would have had a much less difficult situation to deal with. At that time, debt was around 40% of GDP. Per capita share of Scotland's debt is likely to peak at around £106 billion in 2016-17. That would be assuming the same kind of trajectory as the UK as a whole, and that would comprise around 86% of Scotland's GDP at that time. What that means is that, especially in an area like social welfare, significant reform is difficult if you haven't got an expanding budget, because the gainers usually can't compensate the losers, and the losers are going to be very unhappy should significant change affect their household budgets. So how does spending in Scotland compare with that in the UK as a whole? Spending per head in 11-12 was £3,972 per person, benefit spending in Scotland, compared to the UK spend of £3,658. Spending is higher on benefits in Scotland, about £300 per person per year. The gap has been decreasing. It is now much smaller than it was 15 years ago. It's only 8% now. Spending is relatively higher on older people and lower on children. Why? Because we have more old people relative to our population compared with the UK as a whole, and we have fewer children. Spending on housing benefit is lower due to the more extensive social housing sector and lower rents in Scotland, but spending on disability benefit is significantly higher, due in part to Scotland's poor health status compared with the UK as a whole. In general, for the UK as a whole, benefit spending has become increasingly focused on the old, with the amount spent on those of working age and on children having been static or in some cases in decline. Another thing that's happened with the welfare budget is that it has moved much more towards means testing, particularly for those of working age. Many households face very high marginal effective tax rates. That means that as they increase income from work, the amounts of benefits that are taken away cause them to effectively be paying a very, very high rate of tax. We've built a microsimulation model, and with that we're able to show that a small proportion of low-income households in Scotland face effective tax rates of over 70%. The intention of the universal credit is that this withdrawal rate does not exceed 65%. Doesn't seem like much of a change. But of course, the highest earning people face a marginal tax rate of 45%. So low-income families that are reliant on benefits face higher marginal tax rates. So, so much for the existing position. Suppose that significant reform was possible. What would be the key considerations? One key consideration, it seems to me, is political support for any significant reform. There is substantial support for the notion that welfare decisions should be taken in Holyrood. Around 60% of Scottish voters support the idea that these decisions should be taken in Holyrood. However, maybe the system that voters implicitly would wish for wouldn't turn out to be all that different from that in the rest of the UK. For example, polling evidence suggests that Scots do not hold out much hope that more will be spent on welfare benefits should there be constitutional change. And also, it is not absolutely clear, though Scotland has this supposedly more social democratic approach, that voters in Scotland are much better disposed to the notion of the welfare state. For example, 55% of Scots are in favour of the proposition that unemployed people should be forced to work for their benefits, with only 33% against. There has been hardening of attitude towards the welfare state in the UK in general over time, a slight uptick in the last survey that was done, but the disenchantment with the welfare state has been particularly noticeable among the young, who are less responsive to the notion that the welfare state is a national treasure. So, one way of restoring public confidence in the system might be to strengthen the contributory principle, the notion that it's something for something. The link between national insurance payments and benefits received has largely been lost. The state pension is the most costly single benefit, and it is classified as contributory, but most people don't understand the nature of that contribution, and politicians maintain the fiction that national insurance contributions are meaningful rather than simply an extension of income tax. The increasing interest in the restoration of the contributory principle has been worked through by various think tanks. Demos has argued that job seekers' allowance, for example, should be greater for those who have a stronger contributory record. That work incentives for the disabled and non-disabled should be equalised. That would reduce the incentive to claim for disability benefits, and so on and so on. But there are, of course, difficulties with these, and I'm sure we can explore the difficulties associated with that, because if you go to a contributory approach, the whole budget might be larger. Suppose, as another option, that Scotland could fund and administer the benefit system as part of a Devo Max option. What would be the gains and losses from that? Could Scotland operate a separate welfare system within the UK? Well, not many countries have very substantially devolved welfare system, and the usual objection is what's called welfare migration. The idea that states or subnational authorities can free ride on the benefit system of other states by the simple expedient of paying lower benefits so that recipients will move across the border to get higher benefits. Competing state governments could then engage in competitive benefit cutting process, driving benefit levels down to a minimum. The evidence isn't all that strong that that sort of thing happens. Some recent evidence from the States suggests that although there are differences in some of the, I should say, in the US, there are some differences in welfare payments administered by different states, and therefore potential incentives to move. But the evidence that that actually has a strong effect is pretty weak. So, if you accept that, and we can explore that issue, if a different path for welfare benefits in Scotland could be charted, it might be possible to rectify some anomalies without substantially redesigning the system. And I'll give you, to end, a couple of examples where that might be possible. One is skills development. So we have the Department of Work and Pensions operating job centres on the one hand, and with increased conditionality of unemployment job seekers allowance, looking at, they're increasingly looking at issues of employability, which is also part of the agenda of Skills Development Scotland. And there have been a number of reports arguing that these two bodies should be working together more closely. So could there be an argument there for actually Scotland taking over some of that budget? My other example relates to the care of older people. In fact, simply the personal care of older people. There are two non-means-tested benefits, attendance allowance and disability living allowance, which are paid to pensioners that are expressly targeted at personal care issues. And it may surprise you to know that the budget of each of these on their own exceeds the budget for free personal care in Scotland, which the media always tell us is the single most important item that will break the Scottish budget. But there are two benefits that actually pay more, two people who are in need of personal care. They both of them pay around £370 million a year, and free personal care comes in about £350 million a year. There was a large amount of debate with the Department of Work and Pensions when free personal care was introduced in the first place, and they refused to make those payments available to care home residents. There must be a way of thinking that perhaps the outcomes for older disabled people could be made better by somehow rationalising these budgets and perhaps giving Holyrood control over them. Okay, thank you.
Thank you, David. Our next speaker is Professor of Economics at Glasgow Caledonian University, and her teaching and research interests are in the areas of the economics of the welfare state, the reform of current social security measures, and the economics of gender inequality. She's author of The Future of Social Security, Women, Work and a Citizen's Basic Income. And she's written a number of articles focusing on exploring just how a basic income can promote greater gender equality. Professor Ailsa Mackay.
Thanks, Shireen. Thank you. I'd maybe like to change tact a bit. I'm the economist who's not going to talk about numbers. Unlike David, not because I don't do numbers, but I want to maybe take David's point about, in the long run, looking at radical change and maybe think out the box and try and be a bit radical without the numbers. So I want to maybe start by saying something around what kind of welfare system we maybe want in a new Scotland. And if we look at the economic policy choices in an Independent Scotland paper that was produced earlier today, there's comment in that the independence debate or the independence referendum provides us with an opportunity to reform our welfare system more, quote, compassionately and in line with a focus on prevention and preventative spend. So I'd like to maybe think about that long-run radical change and looking for an anticipatory approach to welfare rather than a reactive approach to welfare. So if we consider the space and the opportunity provided by the constitutional debate, we should begin with a number of questions. And the two most important questions, I think, in terms of welfare and public services are, what makes a good society in Scotland? And secondly, what kind of welfare system would support that good society? So rather than reform what we already have or what already exists, what is it we want our welfare system to do? What values and principles will inform the investment that we need to make in state welfare support, and how will that translate into policy terms? So if we consider those questions, that provides the space to explore the Citizens' Basic Income proposal, a radical idea. The Citizens' Basic Income proposal involves paying every citizen a minimum income guarantee, paid on an individual basis without means test or work requirement. So it would replace all existing income maintenance benefits, including all relief set against our income tax liability, and the amount paid would be tax-free. So a citizen's basic income would ensure that the financial gains from paid work were always positive, and relates quite specifically to the question that David raised about high marginal tax rates. I think an important one when we look at the current failures of our current existing system. So it would provide a more secure basis for individuals to opt in and out of the labour market, therefore promoting greater flexibility. But more importantly, I think, the universal aspect of the proposal protects against discrimination, and it therefore provides us with the foundations for a truly equitable system of welfare, and one that is anticipatory, preventative and compassionate. The concept itself, though, involves accepting a whole new way of thinking about social security policy in terms of the functions that it can, should and does perform, not just what we want it to perform. And if we understand it in those terms, it is more representative of a radical idea rather than a welfare reform proposal. Now, if we want to think about a radical idea in terms of change, maybe we should stop thinking about the long term. And as Keynes said, in the long run we're all dead. Maybe we should start thinking about the medium term or the short term and actually thinking about radical change in the context of the constitutional debate. I think a citizen's basic income provides the basis for creating the space to rethink what we understand by work, what we understand by income, and what we understand by citizenship rights within the context of modern capitalist economies. The perceived crisis in capitalism and the current economic recession and limited recovery prevents us with an opportunity to reshape our thinking on what makes a good society, how do we value, and what do we value, and who do we value in that society. And crucially, in doing so, we need to develop a better understanding of how the structures and processes of our economic systems can be tailored to better serve the needs of all citizens across all of Scotland's communities. Now, we heard from Chris how the inadequacies of our current welfare system that operates alongside contemporary labour markets has led to unacceptable outcomes. So the current system we recognise as failing. When evidence is presented of those outcomes, it's failing quite spectacularly. From a gender equality perspective, this is particularly the case. The current position of women in Scotland's economy is a cause for concern at a number of levels, and the constitutional futures debate provides a platform for raising and discussing those issues, particularly related to how we can resolve them with regard to promoting gender equality. With specific reference to social security policy, gender concerns should be central to the debate because formal social security arrangements have traditionally served men more favourably than women. This is in part due to the direct relationship between insurance-based benefits in the labour market, but is more importantly an indirect consequence of policies that fail to recognise the diverse role of women as wives, mothers, carers and workers. I think the Scottish constitutional debate provides the space to consider new ideas and proposals that will transform our welfare system into a workable new welfare architecture that will meet the needs of both the Scottish economy and the women who live and work in that economy simultaneously. However, a citizen's basic income shouldn't be viewed as a panacea for all evils or for all ills, particularly the ones that Chris outlined. And not should it be viewed as a standalone measure, but rather it provides us with a framework to build a welfare system that effectively recognises the totality of women's contribution to the economy and wider society. The question remaining, though, is in a new Scotland, is there a desire or a political will to do so? And this, for me, is the most important question. I think within a Scottish context, a commitment to the promotion of gender equality has been a defining feature of the post-devolution political and policy frameworks. So you could conclude that the current political climate within Scotland provides real opportunity to move beyond the confining parameters of mainstream economic analysis in attempts to understand the role of women in the Scottish economy. The door is open, therefore, creating a space for new thinking that more accurately accounts for a whole range of economic activity that is welfare enhancing yet remains invisible within a policy framework focused on the world of paid work and supporting entrance into that world. In the context of social security policy, that open door allows for consideration of the basic income proposal and how it presents as an invaluable opportunity for reshaping welfare policy in accordance with the needs of all of Scotland's people. This brings me then full circle to the initial question. What kind of welfare system would support a good society in a new Scotland? In contrast to current social security measures, a basic income doesn't explicitly link income provision with work. So in this sense, it can be viewed as emancipatory and anticipatory, in that it serves to free individuals from the economic necessity of toil and provides a basis to support a range of welfare-enhancing activity undertaken out with the confines of market-based exchanges, a radical idea. It's not merely an alternative, then, to existing social security provision, but a philosophy aimed at enhancing individual freedom and promoting social justice for all. However, the arguments posed against the proposal mainly focus on costs and the impact on work incentives. And to date, those arguments have won over the very diverse and convincing arguments in support of the proposal. That is, paying people in exchange for what is perceived to be doing nothing is highly unlikely, given the value that we attach in modern society to work. Now, the word perceived I would use deliberately because it depends on what we understand by doing nothing. And this kind of statement indicates a very narrowly confined notion of work and what we value as economic activity. In considering how, who and what we value in the context of gender inequality, if we look at the impact of austerity measures on overall economic performance, it raises a number of important questions. Who was bailed out and why? How was the bailout financed? And who will continue to pay the price? Why is the impact on pay and jobs in the public sector more significant than anywhere else? And how can we justify the level and scope of the current public spending cuts evident across Europe? All those questions relevant to the debate. Now, policies that encourage private sector investment may lead to positive outcomes in terms of boosting aggregate demand, but is by no means guaranteed due to the uncertainty and volatility inherent within global financial markets. And when we account for gender difference, it may be that we conclude that the best way to boost aggregate demand, and this is where we need to think differently, is to effectively target resources towards meeting the needs of women and their families. This would require a fundamental shift in thinking. In particular, it would require an acceptance of the centrality and indeed the superiority of public sector expenditure and the care sector in supporting economic and human development. Now, perhaps it's time that we made that fundamental shift and that we consider a different set of values as a defining feature of our good society. And maybe a citizen's basic income provides us with just the platform for doing so in a more gender-equal Scotland. Thanks.
Thank you, Lisa. Next up, we have the Professor of Comparative Social Policy at Edinburgh University. Can you get in there? He was previously Professor of Comparative Social Research at the University of Stirling and has held visiting research positions in Denmark, Italy and Germany, and his recent publications include a study of British and German social policy in the 21st century. So I guess he can show us a few comparisons. Welcome, Joachim Claassen.
Thank you very much. And thank you very much for the invitation to speak to you tonight. I think one of the attractions of the Scottish pre-referendum period is the opportunity to talk about first principles, if you want, first principles of public policy, which go beyond the here and now and which allow us maybe to look beyond Scotland, beyond the UK, looking at in other countries. And Elsa has already given us one example of looking beyond the here and now. So what I will do tonight is just to reflect on the British, it is a British benefit system, and draw some comparisons with other countries. Now, if you look at social surveys, they tell us that the welfare state is still very popular, has still a very broad appeal. But if you look into those surveys, you'll find that this broad appeal, the strong support, applies more to some areas than others. For example, pensions, for example, the NHS. In particular, these are the areas which are strongly supported. Other areas, working age benefits and unemployment benefits, and David has already alluded to, are regarded with distrust, with suspicions, with claimants potentially cheating and defrauding the system, a system which is hugely expensive. Now, how does that compare with Europe? with other European countries, well, you find similar divisions there, similar divisions and distinctions between what are regarded as deserving and less deserving recipients of benefits. Nevertheless, I think the British image, the public image, or the published image, if you want, towards the benefit systems and towards people in poverty and receiving benefit is rather harsh. I'm referring to a study here done by Danish colleagues who looked at thousands and thousands of articles in newspapers, both broadsheet and tabloid newspapers, and compared Denmark and Sweden with the UK over a 5-year period. And they showed that poverty is a much more prominent issue in the UK than in the other two countries. But not only that, that the negative image of poverty seems to be much stronger in the UK than in Denmark and in Sweden. And the negative images refer to issues such as crime, benefit abuse, immigration, and unwillingness to work. So these issues you find in the other countries as well, but much less so. And in particular, which I found interesting was that the notion of single parents arguably defrauding the system is still a recurrent theme in the British press, but completely absent from the press in Scandinavia. Now, this negative image of welfare, what are now called welfare benefit claimants, used to be called Social Security, now welfare, might be a reflection of the public and the political discourse we are seeing at the moment. Recent policy announcements certainly have reinforced this notion of us and them, us the taxpayers, and them those who are receiving benefit, and this suspicious notion of people receiving benefits. I refer to the most recent budget speech by George Osborne, where he announced a decision to make job seekers sign on more often, meaning weekly rather than fortnightly, and also to extend the waiting periods before benefits become payable. Now, that was justified with the notion that we need to protect the interests of taxpayers versus the interests of benefit claimants. So clearly saying it's us and them, which was very different if compared with the decision to improve pensions, public pensions, slightly at least, with the argument that those are benefits for people who've paid into the system for all their lives. So therefore, we don't have this division between us and them. As I said, you might find similar divisions in other countries, but I think one of the reasons why this notion seems very stark, very strong in the UK has to do something with the architecture of the British benefit system. And we've already heard some points here about how these systems, how these benefits could look like, but basically there are three principles underlying benefits. First one, universal benefits, things like child benefit, disability benefits, already mentioned. Now, Elsa said, this is maybe something where we should strive for. If you look across countries, we see a cut, not only in the UK, if you think about child benefit in last year, but also in other countries. Universal benefits are not advancing. If anything, they're being cut back. Scandinavia still, in Denmark and Sweden, you still have a residence-based pension, for example, so it's not contributory, it's residence-based, but these have become more income tested, so tested against other sources of income. Yes, the degree of universalism is still stronger there, but not stronger there than in the UK, but not as strong as it used to be. Secondly, means-tested benefits, which we've already heard. You find means-tested benefits in all European countries, but, and this is a distinctive UK feature, very, very strong in the UK and having become stronger over the past years and decades, as David has already hinted at. So this is the area where the UK differs a lot, particularly if compared with Scandinavian and continental European countries. And then thirdly, social insurance contributory type benefits. This system is still actually very large in the UK. The UK national insurance system is a huge revenue-raising device, but it is mainly there for people of pension age. It's still half of all benefits are paid out of the National Insurance Fund in the UK. It used to be more than half, is now less than half, which is less than in other European countries. In continental European countries, it's about 2/3, not in all of them, but in major European countries, France, Germany, it's about 2/3 of all benefits are contributory based, and the same applies to Sweden as well, and Netherlands as well. So in the UK, it's still considerably high. It is high, close to half, but most of that goes to pensioners. For working age benefits, the notion of national insurance has more or less disappeared. It's one in 5, or just below 1 in 5 unemployed people who receive the job seekers allowance base as a contributory type benefit. So that is then a big difference between the UK on the one hand and many European countries, that this notion of insurance is still there. And maybe it's, this is the forum, or this is a good time to think about these first principles. What should be the principle for Social Security? What should be the principle underlying social solidarity in the future Scotland? So it might be worth revisiting sort of the debate about the advantages and limitations of these different models, and particularly the idea of social insurance, in my opinion. The advantages, the disadvantages, and the notion, as David said, of something for something rather than something for nothing, which is the central notion here in the UK debate about social security, the benefit systems. If we do that, if we put the whole debate about the benefit system in the broader perspective, I think it could serve 3 purposes. One is that it could shift the debate from only focusing on poverty, which is an important issue, of course, but it could shift the debate from only poverty and only low benefit levels and only suspicions on fraud and abuse to the notion of insurance, to the notion that there should be a knowledge that there's something there, not only for more disadvantaged people, but for all people paying into a welfare system, something there during periods out of work. Secondly, if we look across countries, we see that the governance, the structure of social insurance can look very different from what it is in the UK. And in particular, you find that there's not a single national insurance fund in France or in Germany, but different funds for different risks. So one for pensions, one for unemployment, maybe disability, and so on, long-term care. In addition, these funds are not always run by the central state. They are run by organizations outside of the state or in cooperation with the state. For example, employee and employer representations. And then thirdly, this is my final point, it could, shifting the debate could remind us, or maybe question the notion of involving middle and higher income groups into the social security system, which is the case in France, which is the case in Germany and other countries. So people paying into the system, it's an insurance type benefit, paying out earnings related benefits, 60%, 70% of previous earnings. This seems to be very alien to the UK debate, which again focuses on levels of benefits, and where, if these benefits are too high or deemed to be too high, that would be portrayed as scandalous. In other countries, in France, in Germany, in Denmark, if it would be considered scandalous if these benefits were not only focusing on poverty, but also would not help to maintain accustomed living standards, at least for some time, for people who are out of work through no fault of their own. Thank you very much.
Thank you, Malcolm. Finally, we have the Professor of Politics at Aberdeen University, Michael Keating, who's also Director of the Scottish Centre for Constitutional Change, which is an inter-university consortium based at Edinburgh University. And Michael has also taught universities in Scotland, England, Canada, Spain, France, and the European University Institute in Florence. So I guess a few comparisons there too.
Thank you for sharing. Indeed, I did spend 10 years teaching at this university, and I was a member of the Senate when it was announced that we'd purchased this church. I'd left long before it was refurbished, so this is the first time I've actually been inside it. Now, we were discussing before we went in here about what we would say, and some people said that they were going to do the general, and some people said they were going to be very specific, so I'm going to finish up with some very general remarks about the future of welfare in Scotland and how the constitutional change debate might relate to the arguments about restructuring the welfare state. And I'm going to start with a proposition, which is that the present division of competences with regard to welfare in Scotland is very much like that in federal countries, other devolved countries in Europe and around the world, and it's based upon the principle that redistributive matters should be handled at the highest level, and that service provision can be done at a local or devolved level. And the reason for redistributive matters being taken at the highest level is partly the notion that social solidarity, social citizenship are best expressed through the nation state, and secondly, that you need a larger area to mobilize the resources effectively for redistribution. This was articulated or re-articulated very clearly by the Calman Commission, which paved the way for the Scotland Act of 2012, which did not notably shift the balance of responsibilities in relation to welfare. Now, I'm going to argue that that proposition can no longer be held in its original form, because the whole field of welfare is restructuring, what I call the functional dimension. What we mean by welfare is restructuring, and we know that whatever the welfare state is going to look like in 20 years' time, it is not going to look like the present welfare state. So simply projecting the costs of welfare in the future on the basis of what we do at the present is highly misleading, because there are all kinds of pressures that mean that welfare is going to change, probably in rather radical ways. There's also a territorial or spatial dimension to it, and I'm going to argue that these two dimensions come together in the case of Scotland. Now, if you think about welfare in the traditional sense as redistributive cash benefits of various sorts, the literature suggests that we need to rethink the whole notion of social solidarity and social welfare in a much broader sense, because it is not true that only cash payments are redistributive. We're increasingly aware that all public services are redistributive, and that the services devolved to Scotland, health, education, and so on, planning, are highly redistributive because they impact on different population groups in different ways. And we know that the Scottish Government has taken some decisions, some controversial decisions, that have redistributive implications within the domains that it already controls in favour of older people, students, and so on. Student fees, health charges, free bus passes, and so on would be examples of this. So where the Scottish Government has the possibility of taking redistributive decisions, it has indeed taken them. The second reason is that the old traditional beverage welfare state was based upon what we call the male breadwinner model, a model of the labour market that simply doesn't correspond to modern labour markets. And there's a whole lot of talk about new social risks, precariousness, social exclusion, and so on. The whole vocabulary of talking about need and benefits and social solidarity has shifted to reflect the much greater complexity of the social risks that are being insured against. And the third and possibly most important reason is the general consensus that it does not make sense to pay people to remain out of work, that it makes much more sense to pay people to get into work. This is a consensus from left to right. There's disagreement about how you do it. And on the political right, there's a more coercive approach. On the left, there are more inclusive approaches. There are different ways of doing it, and that's where the controversy lies. But a consensus that we should be linking welfare into the work of labour markets, and that we've been very bad at doing this hitherto, and that no political party or government has ever cracked that one. Now, these are broad international trends. There's a territorial dimension to it as well. If we look right across Europe, we see that the welfare state is changing its territorial scale, because many of these new social risks are different in different places, or the combinations of social risks and problems are different in different places. And we know that a lot of anti-poverty strategies are essentially territorial. They're about going into neighborhoods or cities or whatever, trying to bring things together. We know that the best place very often to link welfare and labour markets is at the local and regional scale, at the level of the labour market. And there is a trend right across Europe to link in active labour market policies, or to deploy active labour market policies at the local and the regional level, because that's where the problem arises. That's where you can appreciate the nature of the problem and make effective provision. The problem is that if you detach that from the welfare support system, then you've no longer got a coherent approach to all of these problems. So the welfare field then is changing in quite radical ways. The nature of the problem is changing, the instruments are changing, and they are territorializing, they're shifting scales. This is part of a broader process in which some things are going up to the European scale, economic regulation and so on. Some things are going down to the local level, some things are maintained at the level of the nation state. So I'd argue that it's no longer adequate to say the nation state is the sole locus of social solidarity, or the most appropriate place to locate all redistributive functions. And we also know, by the way, that small countries are much good at social solidarity than larger countries. So the notion that somehow you need a large country simply isn't empirically supported by the evidence. Now, how does this affect Scotland? In Scotland, these two dimensions intersect in all kinds of ways. And we've noticed in recent months that the constitutional debate is increasingly turning towards these welfare questions. Once we fill in the content of what institutional change is going to mean for public policies, there's an argument about the economy, there's an argument about taxation, but certainly welfare has become very, very central to this debate, and I think will continue to be, whether we're talking about independence or whether we're talking about enhanced devolution, or whether we're talking about the status quo, because the status quo is faced with a world that is changing in all kinds of ways. So whatever happens, these policy issues, these problems of bringing powers and resources together effectively in the right place are going to be there, and I'm not convinced that the present allocation of responsibilities under the devolution settlement effectively addresses those. One can give various examples. David has given a couple of examples earlier on about the way things might be brought together, but in particular, the welfare function, the function of training, the function of active labour market policy, spatial planning, these are all things that have to be brought together in various ways. Now, I'm not a great fan of the term joined-up government, because there's no such thing as joined-up government. But there are certain kinds of things that do need to be looked together, and these are these things. Now, what has been happening, and what I think is going to happen, is the welfare state as we know it will not exist in 20 years. I think that's quite clear because the money will run out. We've also seen in Scotland some divergences in policy after devolution. You can say there's been a certain tendency in Scotland towards greater universalism, which you may think is good or you may think bad, but there's been that tendency. And the balance of policy instruments, the way of thinking about problems is changing. Not necessarily because public opinion is radically different, because of the way that politics and political competition have worked out, and I think these divergences will continue. The implication of this is that Scotland would end up with a somewhat different welfare settlement from the rest of the United Kingdom, tied into an economic and social project. Welfare will not be exclusively Scottish or British. It will operate at multiple levels, but there will emerge a Scottish space of social solidarity, a Scottish space where the social compromises are made, and that has enormous implications for the division of powers. I think the division of powers needs to be looked at again, and it also, of course, has huge implications for taxation and the amount of money we're prepared to pay. That is a question which all sides have been trying to avoid. We, I think, are heading for a different welfare settlement. The resources, as David keeps on telling us, are highly limited. There's not going to be a huge amount of money available in any constitutional scenario. But I think it is possible to use this constitutional debate to think about how we could organize social solidarity and welfare here to face the new challenges, not to face the challenges that we had when the present welfare state was set up back in the 1940s.
We're going to open it up to the floor now, and we should have some roving mics there. Karen, have you got some roving mics? So obviously we've heard different models for welfare provision. We've heard that there's a need for a rethink. Anyone got any points that they would like to make or questions they'd like to raise with the panel? Chuck up the mic, please.
Good evening. I'm David Howie. I've recently graduated, 2005, with a degree in multimedia. I'm now doing my degree in PPE. One of the questions that I'd like to ask the panel, which wasn't raised today, was on people with disability getting back into the workforce and what economic benefit you see that having in independent Scotland.
Could you just hold the microphone a wee bit closer again and repeat the question?
Yeah, sorry. Basically, what my area was that I do a lot of charity work, and what we're finding is that people with disabilities aren't able to get back into the workforce. Right. What benefits do you believe to an independent Scotland would have if it could focus on that area of getting people with problems back into the workforce?
Right, who would like to take that first? What benefits? Did you get a question?
It was about. It's not my field. It's more your field.
Sorry, can we ask you to repeat the question again? It also, I think, does he want to answer it, but we're not quite.
No problem. Yeah, so yeah, a bit better. Basically, from my area of working in charity, what we're finding is that a lot of people with disabilities are excluded from the workforce. Now, my question was, what benefits do you believe to an independent Scotland would be to get those people back into the workforce?
It's about people with disability benefits, what in an independent Scotland benefits to help them get back into work. That's a big question. They're having a think about it. Chris?
I don't think it's just a question for Scotland. I'm not sure how the change as a result of the referendum might affect it, but it is a big problem whether or not Scotland becomes independent one of the strands that has to be part of an effective approach to reduce poverty is to look at very high rates of poverty among disabled people as well as families with a disabled child or adult in them. I think 1 in 3 families in poverty have an adult or a child who is disabled. So it's a huge part of the overall problem of poverty in Scotland and the UK. And it's one area where it hasn't really been joined up, to use that terrible phrase. Disability has got its own policies, and in London there's an office for disability issues that looks after policy on disabled people. So it's often just given lip service in approaches on poverty, whereas it really, you could argue, it's one of the most important strands. It has to be right at the heart of it.
Thank
I don't know if that's any useful as well.
Lady down here.
Catherine Smith, a completely cynical person, looking at a Scotland which, with enhanced care for the elderly and very few prospects for youth, has increased the rate of the ageing population, would suggest perhaps that compassion plus prevention is euthanasia. Now, I'm not suggesting euthanasia, but I do suggest that we have here a number of different presentations which have talked about a lot of important issues without addressing some fundamentals, such as, in order to have viable welfare and public services, we need, first of all, to have a widespread responsible attitude towards each person making the best effort they can to contribute to the country's wealth from which welfare and public services derive. Now, to each according to his needs, from each according to his ability, does actually imply that we should all be thinking about responsibility. And I would ask every member of the panel, given the scenario that if we had been independent in 2004, our finances would now be significantly encumbered by the debt of the failure of 2 massive Scottish banks. Given that scenario, in what way would an independent Scotland, without a firm, viable policy for fundamental wealth improvement, actually have the basis for radical change, so that we can recognize that gainful employment is only one form of useful employment, and redistribute our commonwealth accordingly?
Well, Michael, do you want to go first?
Okay, well, one thing I'm working on at the moment is looking at other small independent states and semi-independent places with devolution max like Quebec. And some of them are successful and some of them are failures. Generalizations about small states don't get you anywhere, really. But there are different kinds of strategies, and one strategy that has attracted some attention is this notion of the social investment state. That is, that you can use social investment as economic development, that investment in early years education, investment in childcare, which allows women to get back into the workforce. These things are beneficial socially, but they also have an economic payoff. They're expensive, and small states who do this tend to have rather high taxes, but the investment comes back. And that concept, I think, is a very useful one in linking the social and the economic. You don't have to be an independent state to do this, so this is quite without prejudice as to whether Scotland becomes independent or not. But whatever powers you have a vision that links those together. It involves taking hard choices. It's not an easy choice. And it also involves thinking in the long term, spending now to avoid problems in the future. And our political cycle doesn't actually facilitate that because politicians think short term. But I do believe that that has got to be the vision.
Joachim, you were talking about social insurance.
Yes?
Yeah, I mean, that notion of something for something. Which...
Well, I'm not sure whether I would have a decent answer there, but I think rather than starting with sort of a general question of where do we go from here, where do we want to go from here, I start sort of empirically, and I look at other countries, as you do in other areas, and see what we could learn from other countries. And there are changes, right? Which countries are seen as successful changes every few years, of course, but there are certainly different models. And though I have my problems with social investment as a notion, because I don't really see how social insurance is not a social investment. If you insure your skills and qualifications and get a decent benefit when you're out of work, looking then for an adequate type of employment, that's also a form of social investment. But anyway, so, for example, if you look at smaller countries such as Denmark, which have certainly a different type of welfare benefit system, that and have these areas which you mentioned, childcare, in order to allow more women into work, decent infrastructure, high qualifications, have sort of these activation policies, active labor market policies, and so on. That is a model one could talk about empirically, but the other side is, of course, the tax issue. Right? I mean, VAT in Denmark is 25%, and cars are very expensive if you want to drive a car in Denmark. And, tax generally is expensive. So while there are limitations to our way of, or our ability to spend on welfare, one would need to raise the tax question and sort of the social justice within the taxation question, which is, of course, for me, essential in the whole debate.
Yeah. Ilse?
Yeah, I'd just like to add to that about the social investment model and the relationship between the social and the economic. I think is missing now that the Beveridge Welfare State Plan was based on the link between economic and social policy, and often is referred to as the kind of first marriage of social policy and economic policy when Beveridge looked to Keynes and looked at issues around affordability. I think that marriage is broken down, and I think what we have again is economic policy taking precedent and social policy taking a back seat to that, and we need to find some way to link the two together, and the social investment state is a particular example. And whether it's the right one or not is something that we can debate. But I think the question about gainful employment is really important, and what we mean by gainful employment. And I'd like to remove the word employment from that and talk about gainful work. And I think a lot of individuals who engage in unpaid economic activity are currently ignored and remain invisible within our current system. But there's an emphasis on gainful employment and finding a job, as opposed to recognising the kinds of things people do either on a voluntary basis or within the household on a regular basis.
David Bell.
Essentially, the Scottish Government has got a lot of control over the levers of economic development. In fact, Scotland, I think, spends 3 times more per head on economic development than is the case in the rest of the UK. That's one of the areas that it spends much more on than the rest of the UK. But with a lot of these things, it's often quite difficult to know what works and what doesn't work. And some of these touch into areas of social and welfare policy, and Ilse has mentioned early intervention, where the evidence seems absolutely clear that early intervention can have very beneficial effects in terms of productivity, but also a lot of social benefits as well. And we're gradually, at a snail's pace, it seems to me, getting that message and starting to focus more on the very, very young. But, I mean, if you want to have a lot of such investment, as Jochen says, you've got to think about taxes. And we do have an extraordinarily, a very unequal distribution of income in Scotland. Not quite as unequal as in, say, London, but still very unequal. And what that means is that Scotland, for example, relies very, very heavily on a very small number of individuals who are contributing a large chunk of our income tax. So in fact, the top 1% of earners contribute 19% of total income tax revenues, which is the main source of revenue to the Scottish, what would be the Scottish government in an independent Scotland. So there are lots of ways of thinking about trying to have an income distribution where you are less dependent on a very small group of people. But any such attempt, if you knew what policies that were most appropriate to effect that, would be on a very slow burn. It would take a long, long time. Effectively, the big increase in income inequality started in the 1980s in Scotland and has gone on for about 30 years. It'll take a long time to reverse it.
Do you agree with the Institute of Fiscal Studies findings this week that in an independent Scotland, Scots would have to pay higher tax or face cuts in public services?
Well, I mean, the questions there are mainly around a bunch of assumptions as to what an independent Scotland would do. So, it's deemed that Scotland would have a somewhat larger budget deficit in the short run than the UK. But actually oil, that's if you exclude oil. If you include oil, it becomes smaller. But over time, oil is expected to decline in value. So then you come up with choices. And the choices that you might make actually are maybe things that people don't immediately jump. It doesn't jump immediately into their imagination. So one of the assumptions underlying the IFS work is that Scotland continues to buy its share, its population share of the total defence spend in the UK. So that's 8.38% of a budget of about 40 billion. Turns out to be about 3.5 billion. And if you count that by billion, which is the SNP policy, I think, you would still have a larger budget as a share of your national product than most small European countries, but you would have some more space to deal with any problems. But I think that there would still be, in the long run, on unchanged policies aside from, say, some moving around in defence, and assuming that population ageing has an impact on quite a substantial impact on the spend, that there would be pressure, that there would be long-run pressure on budgets. And the difficulty is that most of the small countries that we've heard about have relatively small debts relative to their GDP. So you talk about Norway, Sweden, Denmark, for example, their debt-GDP ratio is nothing like 86%. Now, debt isn't necessarily a bad thing, but What is a bad thing is if the markets lose confidence in you and won't lend you money. That's the sort of showstopper. You really don't want that to happen. So that's the basis for, I guess, the IFS argument that even with some adjustment at the edges, there still would be an issue around at least in the short to medium term, around the Scottish budget.
I'll maybe get the views of the other panellists on that in a second, but Chris, if I could ask you to address the question.
Yeah, so I think the question is about how you shift attitudes in society, and that's very difficult. It's generational shifts really that cause that, so it's not something that's going to happen overnight. And it's all, by the same token, you can't say, well, which country should Scotland or England become like? It's more useful to think about who's the nearest neighbour, who should we become more like, rather than what should we transform ourselves into. I think try and think about it as an evolution rather than a revolution is more realistic. So I'd be interested in the European end of the table, what the kind of the best, closest neighbour for Scotland would be in terms of welfare and the issues we've talked about. So I'm not allowed to ask questions.
The best.
A question with a question. Which is the best model in your view?
Well, the closest model is south of the border, yeah, because it's basically this model. Yeah?
The closest, closest best one.
Yeah, closest best model. But that's the question. It depends really what you want. First of all, I agree with you. I mean, this is things evolve rather than, you cannot look at another country and then introduce something, like for like. It just doesn't work like that. Even within countries, if, I mentioned Denmark earlier, one thing, what Denmark has become famous for recently is the so-called flexicurity model. That you have a flexible labor market, so the job protection in Denmark is actually very weak, as it is in the UK, so there's not much in it, but you have very strong benefits, relatively generous benefits in Denmark, and then you have a very active labor market policy, right? And these things work together. Now, that has become quite well known, but that was not something which was invented, which just sort of happened. It was a historical accident almost. You have to go look back into the 60s, which I won't do now, in order to understand it. So the Danes themselves found out that in the 90s, we have something which we could give a name, flexicurity, and then the EU has taken it up. So it's very difficult, of course, then to look across countries and then start designing your little welfare, like a Lego thing or IKEA packet or whatever. It doesn't work like that. The best country, if you agree that having people in work and raising the employment rate makes sense, and having going towards proper jobs rather than having a large sector of low pay, very insecure, precarious type of work, then I think you can look at countries such as Denmark and Nordic countries, which have a long tradition in active labor market policy. But that's one aspect, and it might be very far away from what is happening in the UK, because, as you know, in the UK traditionally, family policy, childcare policy is not an area where the government has been very strong at, very interventionist. So it requires a shift. The shift is happening, I think, but it requires a lot more to go down that road. So for that aspect, you might want to look at Denmark. For other aspects, I think, Denmark or Sweden are still very far away. If you look at the taxation, it would be a huge step to introduce that. As I mentioned earlier, VAT and income tax and for imported goods and so on. That would really be a radical shift. And the question is whether you have the political support or the public support to go down that road. So I think there is no one best country, but you can look at different aspects in different countries. For social insurance, for example, I would not necessarily look at Denmark. I would look at other countries.
Okay, there was a gentleman down here with a question.
Hi, thanks. Gavin Francis. I'm a GP in Edinburgh. I wanted to raise a question, particularly to Professor Mackay and Chris Gould, with regard to their references to gender earlier in the discussion. I think all the speakers have spoken eloquently about how in Scotland we like to think we've got a tradition that policies need to be designed to protect the weak rather than reward the strong. And there was the comment that women have historically been neglected in that. Chris Golden commented on the gender gap having narrowed recently. I just wanted to ask for some responses on my reflection, actually, that that's not what I see at all. I mean, I see the disenfranchised, uneducated, furious young men who are unemployable that are the problem in today's society. They're the guys that don't have any services that I can refer them into to help them. The women can get housing. By and large, the women can get jobs in shops, call centres, office administration that the men can't get jobs in. And I wondered what we can do about an economy that leaves unskilled men entirely behind.
Ilsa? Lots of big questions tonight.
Yeah, I'm not sure I got all of it, but I think I'd like to maybe refer to the previous answer about a shift in attitudes and evolution as opposed to revolution. I think that's really important, and I think we need to look at it in the whole, that we can't just focus on the supply side of labour. We need to look at the demand side and the role of employers. And in Denmark and welfare states that we view as similar to Denmark, that social democratic model, the role of employers is really important in partnership working with the state and with workers. We've lost that, I think, in the UK and here in Scotland. So we need to look at some kind of shift in creating a new partnership of working. And I think in that shift we need to think differently about the priority given to the role of employment. We need to look at the role of employers, the notion of work, as I said earlier, and the role of the public sector in that. The public sector is not the enemy of economic growth, but rather, I think, as David referred to, can be extremely productive in contributing towards economic growth. And more crucially, and I think that's the one that we've missed when I talked about the second marriage of justice and efficiency perhaps, the role of households. Because we've ignored households in the past, and I think at our peril, because resources are depleting from households and going into the formal labour market with the resulting consequence in terms of the kind of levels of poverty and social exclusion that Chris spoke about. If we retain that level of poverty and social exclusion, then it indicates that we're not addressing the gap in households at the moment in terms of resources going in and resources coming out.
And do you think we're better placed to achieve that in an independent Scotland or from a UK perspective?
Well, that's a big question. I think
Lots of big questions.
I think we would have the space in an independent Scotland to consider that. And it's like I said earlier, whether there's the political will and desire to do it in Scotland, we've yet to find out perhaps over the next 10 months. And maybe that's why we're all here and we need to have that debate. I'm not sure that the answer to the question is yes, it would definitely happen in independent Scotland, but I think crucially we have the space to forge that new partnership and that new relationship. Whether we take that opportunity up is, I suppose, up to us.
Chris?
Yeah. Well, the issue about gender, I think New Labour's policies on poverty almost accidentally helped some of the gender gaps. So introducing pension credit was for all pensioners, but because historically single pensioners had fallen so far behind, it helped them proportionally more. And it's similar with low parents, because so much extra was put into child tax credits and child benefits, and low parents had fallen behind so badly, they were helped proportionally more by the policy too. And when you look at the national minimum wage, there's a similar story. So low pay rates for women shortly after national minimum wage was introduced went down quite considerably. The rate for men wasn't touched at all, but it was much higher to start with for women. So there's a kind of similar pattern across those three areas of policy. But I think now we're in a situation where poverty among young people and the living standards of young people is a real concern. And we saw that in the Institute of Fiscal Studies analysis of the poverty figures this year, where they focus very much on that intergenerational injustice that has been going and looks set to go in the future. So I would totally agree that poverty of young people and the opportunities is probably the biggest problem we've got on the horizon, and it's happening now, as you say.
David would like to comment on this as well.
Okay, fun enough, I was listening to a story on the radio yesterday morning about young graduates not getting into graduate type work and their wages in the work that they could get falling. So I had a look at the statistics on that, and what I was able to show was that it's not just true of young graduates, it's true of all young people, all of the 16 to 24 age group, which we consider youth. And so over the last 10 years, rather than getting about 58% of an average adult's wage when they start, they're now down to about 50% of an average adult's wage. And some of this is around the types of jobs that are now available. And there's a long story that I won't go into about the kinds of jobs that I guess particularly young men 30 or 40 years ago would have had opportunities in that just no longer exist. They've been competed away by other countries, or the technology has changed so that they're not there anymore. And so there really is, I think it's also true in the States, where amazingly, at the bottom, the last year's statistics showed that the life expectancy of poor white men is actually falling, which, in a modern, highly affluent country, you just would not expect to happen. There is certainly an issue around men who are disconnected from the labour market.
More so in Scotland.
I don't think it's. So if you look at the overall youth unemployment rate in Scotland, it's about the same as the UK, which is about the same as the EU as a whole. It's double that in Spain.
Right.
It's double that in Greece. It's actually higher in Sweden than it is in Scotland. But we're talking 22%, where the adult rate is 8%. It's a massive problem.
You had your hand up over there. Come to you next.
Thank you. My name is Owen McHugh. I was very struck by Chris Goulden's comments, and I was wondering what the panel thought. If it were to transpire that we voted for an independent Scotland, would this not be the ideal opportunity, and I would be interested to hear what the panel thought, for a quiet revolution? And the quiet revolution could maybe have us looking at the breadth of ambition, the vision of what poverty, the lack of what poverty means, and perhaps setting up an effective strategy to deal with it. And I just wonder that we're a wee bit lacking in the debate as to what the impetus of having an independent country would bring to all forms of lifestyle in Scotland.
Chris, well, actually, you also
I was going to say something very quick.
Yes.
I think it's probably the closest to evolution that we're going to get. So I'll probably take that.
Michael.
Yeah, as I was saying earlier on, this constitutional debate, which tends to bore people, takes life when it's connected with things like the future of welfare, but substantive things which are very important. And we should have had this debate after devolution, and we really didn't, because there was so much money around that hard choices didn't have to be made, and now they have to be made, and it coincides with this debate. Not necessarily about independence, but about where the settlement is going, whether it's some enhanced form of devolution or whether it's independence or whatever it is. Another point that is vitally important is that if we're going to sustain these kind of long-term policies that we probably all think would be desirable, investment for the long term and looking at the next generation rather than simply consuming in the baby boom generation, we've got to get the institutions right. And the institutions don't simply concern Scotland's relationship with the United Kingdom or the relationship with Europe. It's institutions within Scotland, how Scotland is organised internally as a political community. And we've not got that right. We're not really very good at taking those hard and long-term decisions. Elsa talked about social partnership. What marks the United Kingdom out from almost the whole of Europe is the notion that social partnership is just dead, and it's been dead for 30 odd years. And I'm not talking about the old kind of style of corporatism, which is sometimes very rigid and you get the employers and the unions together, but some notion that stakeholders do have a common interest and that you can face up to problems by working together. And I'll give you two examples of that. One is the proposition here that you can cut corporation tax for the whole of business without asking anything whatever in return. We'll just do it, and somehow they... other countries don't work like that. They'll say, we'll make this concession and you give something in return, and the trade unions exercise wage restraint and they get something in return. And the other example is Grangemouth. What a fiasco. What a way to organize your policy system and almost lose one of the mainstays of the economy, not for fundamental economic reasons, just because an industrial dispute escalates out of hand and it ties into all kinds of other things. That's a failure of institutions, and whether we're independent or not, we've got to get these institutions right.
Yes, there's a question down here. Just here, yes.
Des McNulty. I think the constitutional debate does permit us to have a debate about welfare and public services, but I'm not sure we're having it. In a sense, I think David was getting onto it there when he was talking about intergenerational issues. And I think there are, really quite profound choices between universal approaches to welfare and more targeted ones, which come out very clearly, for example, in what was being said about the interventions in child poverty and the welfare support that was given, particularly in the kind of mid-2000s by Gordon Brown's Gordon Brown in the Treasury. But it strikes me that in this constitutional debate, we're actually talking around the fringes about principles about welfare, and really very rarely about practicalities or the difficult choices. If the logic of David's position is right, that we're going to have to decide not to do certain things in terms of welfare, certain things can't be afforded, and that will be true whether we're part of an independent Scotland or remain part of the UK. Then in a sense, the issue we should be focusing on is what are the consequences of that? What are the choices we actually have to make? But the constitutional debate, it seems to me, almost gets in the way of that we like to talk about the things we want to talk about, how things could be, things could be improved, not about the difficult choices we actually might have to make. And I do think that there's a kind of lack of historical perspective in all of this as well in Scotland. That we forget the opportunities we had in the period since devolution and what we did with them. So is there a sense in which we should be learning from what has happened during devolution and using that as a mechanism to look ahead, rather than getting into a kind of in-principle debate about things that we may not ever be able to do? It's nice for us to be able to think that we're fair in Scotland, but the reality is our poverty statistics are actually worse than south of the border. So, there's a sense in which we're involved in comfortable delusions here and not really facing up to the choices, and that's happening through the constitutional debate, welcome though it may be in some respects, but it seems to be characteristic of it.
Isabel, has the debate been guilty of some comfortable delusions, do you think?
Well, I think I started off by talking about what I was doing was talking about the short and the medium term, and really assuming that because the gainers from a different system couldn't immediately compensate the losers, that nothing much in the short term is going to happen. We may well start these hairs running about a completely different system, but the change actually will be evolutionary rather than radical. And Des is right. I mean, there have been lots of opportunities during the time that devolution has been with us for doing more radical things. Now, so some things have happened south of the border that you might or might not agree with, but actually, decisions have been made and policies have been put in place. I'll give you one example of that, and that is direct payments. So rather than the provision of services by local authorities to people who need forms of social care, let's say, England has progressed much further than Scotland in relation to giving people cash and then letting them decide. Now, you may or may not think that's a good thing, a good approach, but Scotland has been terribly tentative about experimenting with that kind of provision. Our budget on that last year was £59 million out of a total Scottish Government budget of around 12 billion. So it's not, we just put our toe in the water of some policies. And, in a sense, devolution's been a bit of a disappointment in that respect.
There's a questioner down the second row.
Yeah, thank you. Anne Henderson, I work at the Scottish TUC now. I'm kind of suffering from a bit of frustration, I think, really. I can't quite work out why. I think some of the opening contributions kind of flagged up that there was an opportunity to do things differently. And I feel as if we're not grasping that opportunity. And I don't think it's just because it's necessary to have some of these debates because there is an important vote on the 18th of September next year. It's also because what's actually happening in our society and the tone, we're still, even in the contributions, there's a kind of implicit thing that an ageing population is a problem, for example, or that I felt there was disproportionate emphasis on problems with the benefit system. I just kind of feel that we're not thinking big enough. I mean, I kind of remember when I was younger thinking there will be a time where everybody has work, has good quality work, doesn't have to work 60 or 70 hours a week if they are in employment, where we do support everybody at different stages in their lives with the services that they need. And that's still what I would like to see, and the welfare and public services that we have around that should support that. And I'm just was thinking when some of the contributions have been going on, even that last reference to direct payments, there's a consequence of the direct payments on the worker who is delivering the service for the person who's using direct payments. There's a whole series of issues around irregular work patterns for that person, lack of training, access to maternity pay if they need to be off. There's a whole number of conditions of employment there that are actually quite threatened by that. Unintended consequences. Child tax credits was referred to there as having been a good and redistributive benefit. What child tax credits also did was shifted large amounts of public money into the private sector through paying exorbitant private nursery fees to allow parents on low and middle incomes to stay in work. We're recycling money into the private sector. The current housing, I was thinking we're in Glasgow, I was thinking about the rent strikes of 1915. There is no cap in the private sector rented sector at the moment. It's causing people of low and middle income to really, really struggle with cuts in their wages, and we're not tackling it. I think we kind of have to go back to basics. A roof over everybody's head, education, healthcare, and look at how we're going to deliver that. I just feel like we're not really talking about that. And I alongside that, obviously coming from where I work, that involves good working conditions, it involves access to regular work, it involves an understanding that people's lives, I like the point that one of the speakers made about a cycle of work and a cycle of life. I think that's important, but we have to be able to provide quality jobs and a flexible approach to the amount of work that people will do. And an ageing population can still see people in work. There's some very good models, and I read some German car factories where making a tiny adjustment in the speed the production line worked at allowed a whole series of older workers to remain in the workforce and the production line to still work efficiently, rather than get involved in disciplinary measures and putting people out onto disability benefits. So I just think I feel like we're not thinking big enough, and whether or not the vote is yes or no, we need to think big and we need to get on with it, because people are really struggling out there.
Okay, thank you.
No, I'd just like to agree. Say yes. I think it goes back to a couple of points that were made about our institutions, and I think Wilkin made the point earlier on about our institutions are built around a male breadwinner model, and that was never relevant at the time, and is certainly no longer relevant. And the whole basis of social insurance was built around a full employment economic strategy. That wasn't really relevant at the time either, or we could debate that, but certainly isn't relevant now. So yes, I do think we need to look at our institutions. And the welfare state is an institution, not just a set of policy initiatives that address particular problems, but an actual institution that is built around a particular bias. And that particular bias is gender bias, but it's bias in favour of a labour market that is long gone. And I think that's why we need to consider social partnerships and how they operate within those institutions, and how our economic policies framed, and what kind of institutions inform our economic policies.
Okay, I've got time for one last question, and then yes, you've been trying to speak for a while.
Hi, yeah, I was wondering if there's time in this constitutional debate for a kind of different tact on voting, because it seems like everyone's focusing on the big ideas. And like it was mentioned earlier, we've kind of mentioned taxation, but it's not been, there's been some form, there's conversations going on saying this is how it will make your life better short term. And that's what I feel politics are normally focused on. This is how it will make your life better. This is why you should vote for this. But it seems that the strongest argument for independence, or any sort of kind of constitutional space to discuss this, is the big ideas, the changing in society. Would it be a better discussion to be having if we were more upfront and saying taxation will be higher, but this is what you're getting in return, rather than kind of fringing around that and saying, yeah, maybe it will be better for you short term?
Okay, Michael, do you think the debate's been a bit dishonest?
Yeah, it certainly has been dishonest. Politicians have not been telling the truth about taxation for a very long time. And not just taxation of the rich, because what David said is right, we get a lot of taxation from rich people, but these very advanced welfare states have a very broad tax base. They have high VAT rates, they have high standard rates of taxation, and we've got to face up to that. If we want that kind of state, we've got to pay for it, but you can persuade people that they will get something in return. At the moment, people are not being convinced that they're getting the services that they're paying for. And because right over the Western world at the moment, it's almost impossible to talk about taxation. It's become sound taboo. We've also got an extremely inefficient taxation. No economist would design our taxation system if they were starting from scratch. But it's very, very difficult to change it, because people who lose out will scream and people who will benefit will stay very quiet. So I think political leadership is required here, and we're not getting that political leadership because our politics doesn't reward politicians who take those kinds of risks.
I'm just agreeing with that. I think it's true. If you do want significant extension of the welfare state, then inevitably Scotland would have to pay higher taxes. And how these are designed, how they are delivered, certainly politicians need to address, and they just don't.
We've got some honesty here tonight. Thank you very much. We've run out of time, but I really just thought I'd ask the panel to sum up, ask each of you, when people are making their decision, this is a big issue, welfare policy and public services. When people are making their decision about whether to vote yes or no next year, what are the questions, the big questions that should be in their mind as regards welfare policy and public services? What should they be asking themselves? Chris?
Well, it struck me that there was kind of consensus among the questioners really, in terms of this being an opportunity, the closest thing to a revolution you're going to get in the United Kingdom. But there's no one putting the vision out there about welfare, about other aspects of society that could persuade people to think about that seriously. And that doesn't mean that it's a yes or a no. On the back of that, both sides could try and make that case, but it doesn't seem as though they are.
David?
Yeah, I mean, it is certainly a big opportunity, the biggest we're likely to get. Don't expect immediate change and think about the political leadership that's necessary to get some sections of society to be willing to give up through higher taxes, through whatever, some of the benefits that they currently enjoy in order to promote this better overall distribution. And that needs some political leadership because it's a hard sell.
Yeah, I completely agree with that. I think it's about political leadership, and it's not a question of yes or no vote, but it's who will deliver and who has the commitment to deliver on both a gender equality agenda and a welfare and public service reform agenda that is compassionate and is anticipatory rather than reactionary.
Joachim?
Yeah, very little to add. I mean, I agree. I think there seems to be a general agreement. There are these big issues. If you talk about benefits, you have to talk about taxation. And there is, I've been struck, and to one extent, in some respects, there is a big debate out there, but it's not a debate which is led by political parties. In a way, it should be led by political parties. This is the sort of type of welfare state we think would be interesting to look at. Maybe we should move towards. If you agree, these are the resources we need. These will be the winners, they will be the losers. But that probably, maybe it's politically naive to expect that. But you would need that to have a proper debate on the welfare state.
And finally, Michael.
Well, I think it's quite heartening that the citizens are starting to take the debate out of the hands of the politicians and asking the questions that they think are important rather than the ones that the politicians think are important. And rather than asking themselves what they want, they should be pushing the politicians as to what the consequences of a yes or no vote should be, because it's not clear that either a yes or no vote in itself would change any of these things. But the political parties have got to show what they would deliver as a consequence, either of a yes or a no. And I don't see that at the moment coming out of either camp.
Well, there's a few months to go, quite a few months to go, but we'll have to leave it there. Thank you very much for your questions, and thank you to our panel tonight for their contribution. For the voting time. You didn't know about that, did you?
Thank you very much. I'll not keep you for more than a moment or two. I mean, it does strike me that this is a wonderful building, but the acoustic might be more suited to evensong than an evening seminar, I have to say. Perhaps it's just my age, but I hope that you didn't struggle too much. I could speak for ages about this. I just want to touch very briefly upon a few things. When the Royal Society decided to do this, I think we're very conscious of the fact that at some point, welfare would come right to the centre of the devolution debate. That seemed pretty obvious. Firstly, because the sense of national solidarity, whether that's at the UK level or at the level of Scotland, is founded upon issues such as social protection as much as anything else. And secondly, because, as David Bell and others have reminded us tonight, the spend of the Department of Works and Pensions, which is a reserved matter in Scotland, is the largest single block of identifiable public spending in Scotland. And there's another factor which we've, I think, quite deliberately and responsibly kept away from this evening because it's at a different level. The UK government is partway through a very ambitious programme of welfare reform, which is designed significantly to reduce the costs of welfare as part of the austerity package, but also to change the policy framework within which welfare takes place. And that is an extremely controversial subject. And I think we need to recognise that. So how are we going to tackle this? Well, the best way we could do it would be to get a panel of speakers who really know the subject and are widely respected to contribute, and we've had that tonight. Could I just hold you for a moment or two to reflect on one or two things that strike me as particularly interesting? The work of the Joseph Rowntree Foundation towards an overarching strategy for poverty seems to me to be quite an exciting development for all the reasons that Chris Golden and other speakers were outlining. That's going to come through in 2016 in Scotland. And Michael and others have been saying we need to change the terms of the debate around this welfare agenda, and I couldn't agree more. I mean, we've got to recognise that it's going to be extremely difficult for all politicians, regardless of their political persuasion and preferences, to actually develop a narrative to engage with the people of Scotland on a lot of these really tough issues. The welfare state, as we currently know it, will not exist in 20 years' time. I think that's what you said, Michael. And it's absolutely right. We should have started this debate many years ago. There's a chart in David Bell's presentation which simply summarises welfare spend as a percentage of GDP. And sure enough, during the first decade of this year, the first decade of this new millennium, when the Scottish Parliament was bedding in and devolution was bedding in, that proportion steadily declined. So there's no need really to have a debate. We're in a totally different environment now. I do think that our speakers have raised their sights wonderfully well. Ailsa's challenge to go back to first principles, and she mentioned the possibility of a citizens-based income as a way forward, is really going back to first principles. I suspect that the proponents of the dismal science of economics might have a few things to say about that if we were going to take it seriously. Professor Claassen, I thought, raised her sights wonderfully well by focusing very much on the public attitudes to the contribution-based approaches and the means-tested approaches, and suggesting that in terms of developing a welfare policy which is consistent with our narrative for the future, we're going to have to revisit the whole issue of social insurance together with a redefinition of what we mean by safety nets. And that kind of led in, I thought, very neatly to Michael Keating's points about, the old distinction between redistributive policies and reserved policies breaking down, the growing sense of social solidarity at regional levels as well as at national levels. And I think that in turn leads us into this need in Scotland, once we get through the referendum, whatever the outcome of that, to think quite seriously about what we mean by social protection in our society. So I think we've had a range of really fascinating contributions this evening. I could talk at great length about them, but I do think that we need, as a society, to think really seriously about these issues, not only between now and September 2014, but thereafter. There's a huge amount of intellectual energy around in Scotland at the moment. A lot of the work that's being done, not least the work by the Royal Society in these papers, I think will have a life after September of next year. And I do hope that the RSC keeps a hold of this issue and helps Scotland, both our political class and our civic society, take these agendas forward into the future. So could I just thank you, all the speakers, very much indeed for these excellent contributions and for the papers they've given us, and very much thank our excellent chair, Shireen Narjani, for taking us through that. and fighting against the acoustic remarkably well, like a true professional kind of media person that she is. And safe journey.